Okay, my name is Sean Burke, and I'm a dietary manager for Silver Lake Assisted Living Facility in Dover, Delaware. So we have 97 residents in our facility right now, and we provide them with breakfast, lunch, and dinner every day. We're also providing our staff with lunch every day because of the COVID-19 virus. The staff is not going out as much, and so we're providing them with soup and sandwich every day. Many facilities, our temperatures are checked when we come to work every day. We have to go through one door. We can't go through any of the other doors in the facility. So we have to enter and exit the building through the same door. They take our temperature. They provide us with a mask. They've already given us goggles. So once we get into the kitchen area, we put our mask on, we put our goggles on, and we keep them on all through the day while we're in the facility. The actual work hasn't changed too much because we're still feeding the residents. The change is we're feeding the staff, which is not a regular thing at our building. So that's the one kind of change from that standpoint. So the biggest change is our actual personal protective equipment that we wear, which we wouldn't be wearing under normal circumstances.
Hi, I'm Colleen Burke, and I am an inpatient coder at Chester County Hospital, which is part of the University of Pennsylvania healthcare system. For my job, I work out of the Health Information Management Department, formerly known as Medical Records Department. And what I do is I go through and I read patient records after the patients are discharged and come up with the diagnoses and the procedures that were done, and I assign a code to them that's sent off for billing and statistical purposes. My work life, well, I've worked from home for about 10 years, maybe 10 years. So where I work from hasn't changed at all. I go from upstairs right down to my office and I start working. Same time. What has changed about my work hours is that in the last couple of weeks, the hospital has asked us to take 8 hours of vacation time per week. Because there's not as much work, because people are not coming into hospitals as much for elective procedures or, quite frankly, for medical problems, because they're afraid of COVID. What's coming into the hospital now is COVID. How am I doing? I'm okay. I do think that I worry so much about my kids getting COVID, or my husband, or me. And since I read the records every day of patients who are hospitalized and some who die with COVID, it's sad, and it makes me think more. And I'm very sad about it, and I worry. I worry a lot.
I'm Gracie, and I am a student at American University in Washington, D.C. So when I was on spring break, my university postponed the return to school for students and then ended up canceling classes. So for the last 7 weeks or so, I have been at home in Delaware with my family, doing classes online instead of in person living in the dorms at AU. So I feel like it's not really something that people can really prepare for. I feel safe at home. I'm not leaving my house. I'm fortunate enough to have everything I need at home, and a few people that I'm living with, like my dad, are still going to work, but I trust that he's taking the necessary precautions, and I'm making sure that I'm staying educated about what I can do, but I'm also like recognizing that sometimes I need to take a step back and not consume as much media, because I think with such a high like death count and case count, it can be really scary. So just like figuring out how to compartmentalize is really important. Before the pandemic, I was at school taking classes. I babysat, and I lived in an apartment off campus with one of my friends, and I was just living as normally. I would go out to eat with friends, I would explore the city, I would take the kids I babysit to the park, yeah.
My name's Ethan Needles, and I'm a head cashier at Lowe's in Middletown, Delaware. So things with COVID are annoying, if I'm gonna put it into one word. Starting off, of course, now we are required to wear masks in the workplace. With glasses, these fog up very easily, so it's often hard to see just because there's a lot of fog where my eyes are, and it's hard to do my daily business with that going on throughout the entire day. As well as the social distancing, the whole fiasco of that. I'm not too amazing with that. I'll still high-five my friends at work. Me and my friends will still mess with each other, so not the best at that. But other than that, not much is different. I'm just kind of stuck at home, not really able to go out anywhere. Being a young person, I definitely feel better off more than someone who's older or has, an underlying health condition. So, not quite as nervous for it. Definitely, if I do get it, that wouldn't be the best situation, but I'd still fair-heartedly survive, so I'm not too worried about it. Well, they put up glass all around every register and around the customer service desks, so customers aren't able to get as close to you anymore, so that's honestly a big plus, I feel. Other than that, we are having people monitor us at work to make sure that we, first off, have our masks on, and second off, that we aren't getting too close to other employees or your customers. So really, it's just been cracked down. Lowe's has actually been more busy since the pandemic started. We assume it's because people are just cooped in their house and they're bored, and since we're open, they just come in to buy stuff to do around the house just to give them something to do. So businesses elsewhere slowed down, Lowe's way busier.
I'm Olivia Burke. I'm a York College student. My daily life has changed since COVID-19 because I'm back at home. I'm not in the dorms with my roommates. I take online classes now, which I don't really prefer because I like the structure that classes at school have. But since I'm home now, I get more time with my family and my sister and my boyfriend. Recently, because we've been stuck in the house, we have a lot of time to have family game night and watch movies and spend time as a family. I do try to take as much precaution as I can. So whenever I go out to buy groceries for my family, I always make sure I have my mask on and that I clean the carts as well. I would tell them that this is just a blimp in our history, and if we all stick together, properly social distance, and take all the safety precautions that we can, that we will get through this.